Morning everybody, and many thanks to the world's first Minister for Happiness and the government of United Arab Emirates for hosting us all today and holding this very important dialogue. Can I also acknowledge the Prime Minister of Bhutan, very many ministers and visiting dignitaries here today. And at UNDP we welcome the interest in looking at human happiness as a way of broadening the conversation about what really is human progress and well-being. While income, money, is an important contributor to our well-being, it is of course far from being everything. There's an old saying in English that goes, "Man does not live by bread alone." Well, we must add man and woman do not live by bread alone these days. But that saying very much fits with UNDP's vision for development, which enables everyone to live a longer and healthier and happier life, be educated, have access to a decent standard of living and housing, and have the freedom to choose the kind of life they want to live. And that kind of approach balances the material and the non-material aspects of well-being. Since 1990, UNDP has been reporting on human development and using the Human Development Index to assess and to compare progress across countries. It's a composite index. It includes indicators for education and for health alongside income per capita in order to give a more balanced picture of development. And indeed, when the Human Development Index was designed, it helped broaden the conversation about development progress beyond what has sometimes been described as the tyranny of the GDP indicator. In other words, everyone becomes very interested in how much money is there per capita. But as I said, there are also other things in life. As an example, put forward my own country, New Zealand, where per capita gross national income last in 2004 was the 32nd highest in the world. But then on the Human Development Index, New Zealand is ranked 9th, not 32nd. So while the GDP per capita may be at the lower end of the OECD league tables, the country does score very highly on life expectancy at birth, 14th highest in the world, and on expected years of schooling, 2nd highest in the world. Measuring happiness also promotes us to think about what really the objective of development is. And we need both the objective measures and the subjective measures to get that more complete understanding of how development ultimately affects our lives and well-being. The 2013 World Happiness Report compared life satisfaction and human development levels and concluded that they really do go hand in hand. The countries which scored more highly on the Human Development Index typically had higher average life satisfaction among their people. Those who scored lower on the Human Development Index typically had lower average life satisfaction. But it's also interesting to explore the cases of the countries which didn't follow that pattern and why their populations would have had much higher or much lower life satisfaction rankings than one would have expected given the Human Development Index ranking. We don't know the entire answer to that yet, but there are important questions to think about. Now, obviously, UNDP is far from alone in looking for alternative measures of human development and well-being. There is a lot of discussion about this. We had a very, very interesting conference at the United Nations on this in recent years. I would like to acknowledge the work of the Kingdom of Bhutan to advance the concept of happiness as so important in the well-being and development of the country. And indeed, Bhutan has developed very, very sophisticated indicators for happiness. I know that the government of the United Kingdom is one which has been collecting measures of happiness and objective well-being to inform their policy making. And then, of course, I salute again the pioneering work of United Arab Emirates with the First Minister for Happiness. We hope this too will inspire others to focus on the levels of happiness which their citizens and residents express. So, how might being able to measure and promote happiness affect development policy? Well, people's perceptions of the world around them do tend to drive their behaviour, even when the evidence might suggest a little different story from the perceptions. For example, it's not uncommon for perceptions to be that crime in one's community is very high, but actually, when compared to other communities and countries, it may not be. So it's important to measure the perceptions, but also to collect firm data and then think about the issues that the gap might be following up. Understanding what drives our sense of well-being then can also reframe the way in which our governments work. In Chile in 2012, the UNDP National Human Development Report was on subjective well-being. And this report looked at links between people's happiness and Chile's development goals. It actually had an unexpected impact on policy. Our report argued that if subjective well-being was a development goal, then it really needed to be addressed in the government's development policy. And the Ministry of Education in Chile then responded by designing a new curriculum, particularly aimed at the Year 10 and Year 11 students, which pays greater attention to pursuing personal well-being. And that curriculum aims to inspire young people in Chile to think not just about the kind of job that they want, but what kind of life do they want to lead, and how would they actually map the way to getting to that. And indeed, a greater focus on happiness by governments could change policies in many ways. An obvious area for action is in mental health, the state of which is such an important driver of happiness. And I was very pleased to hear the Minister in her comments focus a lot on the issues posed by mental health in this regard. There is a recent study which brought together findings across many surveys in a mix of high, middle and low-income countries, reporting that on average 18% of adults, that's almost 1 in 5, experienced a mental disorder of some kind within the previous year. The metric of disability-adjusted life years, which captures both what makes us sick and what kills us, suggests that the global burden of disease from mental and behavioural disorders is rising, and that depression alone is now the second leading contributor globally to the number of years lived with disability. Yet, until recently, mental health rarely featured in international conversations about development. In many parts of the world, sadly, shame, stigma, and the absence of enough mental health care and diagnostics mean that there are few options for those who need services. So more needs to be done for those living with severe mental illness who are marginalised, mistreated, discriminated against, or even denied their basic human rights. Let me say a brief word on the new Sustainable Development Goals, happiness and well-being. The global development conversation is going to revolve around these goals and the Agenda 2030 for Sustainable Development in which they sit for the next 13 years, right through to 2030. This agenda puts people at the centre of sustainable development as its ultimate beneficiaries and seeks to balance across the 3 dimensions of sustainable development: the economic, the social and the environmental. And the agenda aims, and I quote, to ensure that all human beings can enjoy prosperous and fulfilling lives, and that economic, social and technological process occurs in harmony with nature. So consider just 2 specific areas of the SDGs, health and governance. These are both fundamental to human development and to happiness. On health, the agenda calls for achieving universal health cover and access to quality health care in order to see that nobody is left behind in our societies and to promote physical and mental health and well-being. And the new Sustainable Development Goal 3 is dedicated to ensuring healthy lives and promoting well-being for people of all ages. All of the Sustainable Development Goals touch on the social, economic and environmental determinants of health. If poverty, hunger, poor housing, lack of access to education, toxic environments and conflicts can be overcome, then health will obviously improve. If gender disparities in education, the lack of access to sexual and reproductive health services and rights, and all forms of violence against women are overcome, the health of women and girls will improve. Better health should increase happiness, and better health will raise human development. On governance, the 2030 Agenda is clear that achieving sustainable development requires peaceful and inclusive societies, justice for all, and institutions which are effective, accountable, and inclusive at every level. Empowering people to have voice is both a means to and an outcome of human development. Freedom to make one's own choices has been identified as one of 6 key drivers of happiness. So, if we are serious about increasing human happiness, we must also be serious about achieving this wide range of new sustainable development goals. To conclude, when thinking of what development advances mean, so many are still drawn instinctively towards that measure of economic growth, what I call the tyranny of GDP. But actually, the quality of growth matters a lot. Whether it is inclusive and sustainable has a major impact on human development and well-being. And paying more attention to happiness should be a component of our efforts to achieve both human and sustainable development. Thank you very much.